So before you get started with the goals of care conversation, there are 3 things to remember. The first is cues, the second is the medical agenda, and the third is prognosis. So Chris, with cues, they're kind of like a little hint that the patient might want to talk about something. They can be verbal or non-verbal. For example, the patient may say something like, "I'm worried about my daughter's wedding," which is in May. This may be a cue that they're worried about timeframes and what the future might look like. So when you notice a cue, it's a time to pause the conversation and just check in with what the patient's concerned about. You might say something like, "Sounds like you might want to talk about timeframes or what the future might hold." So follow the patient's cues and help that lead you through the conversation. Sometimes they don't drop a cue though.
So if you don't get given a cue and you know that you're about to have to give them some bad news, you have to lead the conversation. And that might occur if you've got a CT scan or blood test results that actually are going to give bad news. It may be that they've had multiple admissions over the previous 6 to 12 months to hospital and things are changing, or you're just noticing that they're becoming increasingly frail. And in any of those cases, it would be appropriate to try and negotiate some limitations to their medical treatment. So you might actually say something like, "Now that we've got these scan results, things are on a different plane, and would it be okay if we actually talked about the future?"
So that kind of brings us on to the next point, which is about prognosis. Before you can have a conversation about limiting medical treatments, you need to have a conversation about prognosis, or at least make sure you're both on the same page. If you know your patient really well, you may not need to do that. So the best thing to do is just ask them what their understanding is about their disease or their condition, or ask them what they see the future like. And also check in with them if they'd like to talk about it, because not every patient does. So those are the 3 things to look out for before you get started on a conversation. See if there's any cues that the patient is ready to talk about it. You might have to bring it up yourself if it's on your agenda, and just check in with them first that they're clear about their prognosis.